By 1925, all U.S. states had a national disease reporting
I'm
system.
sorry, whoever just coughed needs to leave.
Also, researchers madly tried to identify the germ that was producing it. And there were a lot of research going on, and they identified what they thought was it, but it turned out, and they named it Haemophilus influenzae, Haemophilus of the flu. It turned out it had nothing to do with the flu. It was an innocent bystander.
Do humans contract it from animals airborne, or is it from consuming the animals?
It's all airborne. And in one of the things we're learning about, first of all, I should have given a disclosure to this group before I started so that you know that any conflicts of interest I have. I know a hell of a lot less about flu today than I did 10 years ago. And so take anything I say today with a grain of salt necessarily. We've learned so much new information about influenza in the last 10 years. And one of the things we've learned is that by far the most effective transmission may not be what we once thought. Surfaces probably play a very limited, if any, role at all. Yet we talk about hand washing and surfaces. Droplets, which we thought were the primary mode of transmission, which are those big boulders we blow out that actually go no further than 4 to 5 feet, were thought to be the primary way. Now we have very good data showing that aerosols, the things that just me talking up here, that may fill this entire room in a matter of minutes. If you want to understand an aerosol, next time you go to a major department store and you're 4 aisles away from the perfume department, but you can still smell the perfume, that's an aerosol.
Basically, what he just said there was, we cannot prove this virus or any virus is spread through surface, through coughing, droplets, sneezing. So it must be this other way, this other mode of like talking and just being in a room with someone. This must be the way it's spread because we don't understand it. We don't have good data. We don't understand this. Like you said, we don't understand it any better than we did 10 years ago. So in this video, it's a very simple idea that I want to put forth this question. If we can't say that the virus causes people to succumb and die and have all these severe lung issues, if we can't say the virus is causing that because we see so many people have the virus and show no symptoms or little symptoms, and this is what Palma, this is what Carnival were saying, this is what many others have said, we cannot say that the virus is causing the death if we see so many people that are doing just fine and have the virus as well. It can be a contributing factor, but we can't say it's the cause. So what I'm asking is, what is the cause then? And can we figure it out? Can we figure out what the cause is? And shouldn't we be looking at that?
They're still studying today.
The 1918 pandemic caused the global deaths of probably 50 and maybe up to 100 million people, making it the worst natural disaster in all of recorded human history.
But what made the pandemic so lethal? NIAID's Dr. Jeffrey Taubenberger has been studying the 1918 flu for decades.
Most people who had influenza in 1918 had a completely typical course of influenza, like you would see today. But in 1918, a really unusually high number of people ended up having very severe illness, meaning that they actually developed a pneumonia, an infection of their lungs.
Like the Grim Reaper, the virus rips through and just randomly kills people, right? Healthy people, young people, old people. It really doesn't matter. All you can really do is hope for a vaccine and protect yourself as best as possible. Try to not come into contact with it. I mean, that's what the media will have us believe, and our modern medical system. Take a look at what's actually causing these deaths and how it's the particulars of being healthy that make the difference.
Viruses interact differently with different people. What we know about the 1918 virus, and we saw again in 2009, is the fact that these viruses actually cause the immune system of the host to react. Many of the deaths with seasonal flu occur when somebody develops a secondary bacterial pneumonia as a result of damage to the lungs. In this case, this caused what we call a cytokine storm. Cytokine storms are where you set off almost like a septic shock picture but you don't have bacteria in your blood, and it causes severe damage to all your internal organs. Today, we can't handle these kinds of illnesses with this cytokine storm any better than we did in 1918. It's not about antibiotics.
And it would damage all the organs in your body: liver damage, kidney damage, brain damage. And this is what we think now was what we would today call acute respiratory distress syndrome, which is it's a huge outpouring of your own immunologic system, and your immunologic system just gets turned on and starts running out of control, completely out of control, so that it attacks the body all over and basically destroys your body from the inside. And we today call it a cytokine storm. Cytokines are some of the little proteins that the immune system uses to attack invaders in the body. And you have a cytokine storm that is fatal. And in the autopsies that were done in that era, it looks like about 50% of the people who died in the great flu pandemic were due to cytokine storm and acute respiratory distress syndrome.
That it induced a really strong and very unusual kind of inflammatory response, so that the body's response, immune response to the virus itself, contributed heavily to lung damage and pathology, and probably contributed to serious illness and death. So it's this very unusual inflammatory response that's one of the key active research focuses of my laboratory, to understand why the 1918 virus induced that.
I could play dozens more clips, but I think you get the idea. We're talking about the cytokine storm, the inflammation that plays a role in all disease. And so we need to be looking at what causes this. So if a healthy person succumbs to and dies from a quote-unquote virus, then we need to evaluate what was going on. They weren't particularly healthy, were they? Looking at all of the major pandemics, whether we're talking about 1918 or the coronavirus today, or the swine flu in 76, if we look at all of these, what can we see is a commonality, with the people that get really sick? And well, I can name at least 4 issues. Nutrient deficiency, that's a huge, huge part of this. Stress / fear, panic. There's seems to be like war going on, poverty, living in poor conditions like with 1918, infrastructure issues. So that would play a role, and that's also probably why in 1918 so many died. So many were nutrient deficient. They were vitamin D deficient. This was in the winter. They weren't getting the right food. Vitamin A, vitamin C, iodine seems to play a big role, zinc. These are big factors. We also have to consider vaccines were here all along, even before 1918, and some sort of electromagnetic field was introduced during all of these as well, as Dr. Cowan says. And I want to look at each of these individually, but first I'm going to read what Jane's Journey wrote to me. She wants you to know she's not a doctor, but she is someone who, is passionate about learning new things and exploring routes that our modern system doesn't want to explore. So in reference to the cytokine storm and vitamin D, the best I can wrap my head around is the cytokines, 12 different messengers, peptides, are a part of an immune response. Cytokines are regulated by vitamin D, a hormone. Vitamin D is stored in fat. In obesity, the vitamin D is locked into fat cells, causing a low-grade chronic inflammation caused by cytokines being released from fat cells. I'd have to look further into Dr. Campbell's studies he cited. So I'm guessing that during a cytokine storm, the body's immune response is overreacting. One reason may be because of low vitamin D is not adequate to keep the release of cytokines in check. And another reason may be there is not enough circulation D to quell the massive cytokine inflammation damage being done to the lungs. And I think that's a very, very good explanation of what's going on, because the vitamin D is crucial in regulating. And of course, if we look at people who get sick, across the board, you can almost guarantee they have very low levels of vitamin D.
You know, this is killing people, and vitamin D can reduce this by up to 70% in low-risk groups. Stimulates immunity to viral and bacterial infections. So this is working by stimulating the immune system. That's why it's working against viral infections, and that's why it's working against bacterial infections, making these respiratory infections less likely to occur. Now, why is this happening? What's the rationale? Well, vitamin D reduces the scope of the acquired immune response. Right, okay. So what this is saying is, sometimes when people have chest infections, there's a problem called ARDS, Acute Respiratory Distress Syndrome. And what happens here is we have the small bronchial passages, and these break down into other smaller bronchial passages. And these break down into these large clusters of air sacs called the alveoli, like this. The alveoli. Now, when there's viral or bacterial infection here, this causes inflammation. And the inflammation is partly caused by the presence of the virus or bacteria, but it's also largely caused by the body's immunological response to the virus or bacteria. And what that means is this inflammatory response means that the inflammatory response produces lots of inflammatory fluids, and these fluids collect in the alveoli like this. And they also collect in the spaces between the blood vessels. That's the blood vessels with the blood cells going through there. It also, the fluid collects in that space there. So this stops the oxygen going into the blood, and it stops the carbon dioxide going from the blood back into the alveoli to be breathed out. So it reduces this disproportionate imbalance in the body's own immunological reaction. So vitamin D reduces the scope of the acquired immune response, and it stops this extreme response. So in ARDS, the problem is actually caused by the body's immune system overreacting rather than by the infection in itself. And vitamin D will prevent this or help to reduce this complication.
Our average age is probably about 60 years old in our practice. And so we've seen very sick patients who thought they were dying. I've been putting the videos on my website, and these patients are getting better with these therapies. Basically, conventional medicine has nothing to offer them. They're telling them to stay home. One of our patients couldn't breathe. He was lying in bed, couldn't grab a glass of water because he was too weak. As soon as he started nebulizing hydrogen peroxide and iodine, he made a dramatic recovery. We see their fever symptoms go away within hours of doing an IV on them. We see them orally, if they catch it early enough, they just get better with a mild case. So we're seeing the gamut of people with symptoms from severe to not so severe. And, these therapies do work. And, Dr. Ng and I have been going out to the car, and our staff has been going out to cars and treating people. And, this therapy works. Let me turn it over to Dr. Ng for a few comments.
Great. Thank you. All right, Dr. Ng, to ask the question again, there's going to be some, comments that, there's no proof that these things work. I could get a false flag across this screen. Obviously, this is just your experience. But what do you have to say to people that are saying that this treatment is ridiculous, peroxide, vitamin C, these things don't work?
They should quiz our patients and see what they have to say. The first two people that I took care of were incredibly ill. And these were people I am convinced that if they would have ended up in the hospital, they had a good chance of dying. We're able to treat them as outpatients, and they will give testimony that these are people that were COVID positive, and they responded. We've had a 100% success rate with this, and none of the thousands of patients we take care of out of this office has ended up in the hospital at all.
Up close, am I somehow mischaracterizing it? Are there people of all demographics having serious issues? What are you seeing?
Well, we've been seeing it for about a month now, and Dr. Ng and I just treated 2 patients from the car outside because we're trying to keep them away from our office and keep our staff healthy. So what we're seeing is that our therapies are working. We use a combination of oral vitamins, vitamin A, C, D, and iodine, and then using nebulized hydrogen peroxide and iodine if they're a little bit worse. And then we're using IV vitamin C and IV peroxide. And we are so far treating over 100 patients. All of our patients are better, dramatically better. No one's hospitalized, no one's been ventilated, and no one's died.
I'd say the jig is up. I'd say people are wising up. And all our pharma-driven medical system wants to do is stockpile like Tamiflu or have some sort of pharmaceutical-approved product at the ready. And they talk about this. They talk about their vaccines and, you know, their medications that could possibly help. Instead of, this should be the first thing doctors are looking at. When you come in and you can't breathe, they should immediately start looking to see if your vitamin D is low, if you need vitamin C, vitamin A, you know, there has to be ways to look at iodine and zinc, and they should be running a full panel. They should have something at the ready, like a combination of nutrients, of vitamins at the ready, whether it's synthetic or not. But they should have it at the ready for when someone comes in, because you can just assume these people are deficient in some areas. Scientifically, it makes no sense, because we can see, we can look and understand how these vitamins, these nutrients are contributing to getting sick, getting well. And not only that, these pharmaceutical products are contributing to the inflammation.
Jersey in January of that year, when a number of recruits began to complain of respiratory ailments, something like the common cold. An Army doctor here sent samples of their throat cultures to the New Jersey Public Health Lab to find out just what kind of bug was going around here. One of those samples was from a Private David Lewis who had left his sickbed to go on a forced march. Private Lewis had collapsed on that march, and his sergeant had revived him by mouth-to-mouth resuscitation. But the sergeant showed no signs of illness. A few days later, Private Lewis died. Identified most of those soldiers' throat cultures as the normal kind of flu virus going around that year, but they could not make out what kind of virus was in the culture from the dead soldier and from 4 others who were sick. So they sent those cultures to the Federal Center for Disease Control in Atlanta, Georgia for further study. A few days later, they got the verdict: swine flu. But that much publicized outbreak of swine flu at Fort Dix involved only Private Lewis, who died, and those 4 other soldiers who recovered completely without the swine flu shot.
Okay, just so set the record straight. I was actually on the National Science Advisory Board for Biosecurity, which is the government's oversight group. And what happened was a group in the Netherlands and a group in the University of Wisconsin-Madison both basically allowed the H5N1 flu virus to be recreated by passing it frequently through ferrets, mammals, that then made it mammalian transmissible. And what they were looking for, what are the changes that occurred? Now, had that virus gotten out, it's very possible that we could have had an H5N1 pandemic just from it alone, which, by the way, actually happened once. In 1976, H1N1 suddenly returned out of the blue. And we don't know where it came from, quote unquote, at the time, but now recognize in retrospect that that virus, which emerged in 1976, was identical to the virus that disappeared in 1957, hadn't changed. Well, it would have changed had it evolved over that period of time. And it turned out the Russians were actually doing vaccine research in eastern Russia using live attenuated vaccines, and they were using the H1N strain. And within 2 months, that virus is around the whole world. And it got out likely from the Russian labs. Okay, so we know if flu virus gets out, it's gone. Okay, there is no returning back. So
the vaccines are safe, easy to take, and they can protect you against flu. So roll up your sleeve. Protect yourself.
One of those who did roll up her sleeve was Judy Roberts. She was perfectly healthy, an active woman, when in November of 1976, she took her shot. 2 weeks later, she says, she began to feel a numbness starting up her legs.
I joked about it at that time. I said, I'll be numb to the knees by Friday if this keeps up. By the following week, I was totally paralyzed.
So completely paralyzed, in fact, that they had to operate on her to enable her to breathe. called Guillain-Barré syndrome, GBS for short. These neurological diseases are little understood. They affect people in different ways. You know something, fellas? There's the possibility of neurological damage if you get into a mass immunization program.
No.
No one ever did?
No.
Do you know Michael Hatwick?
Yes. Mm-hmm.
Dr. Michael Hatwick directed the surveillance team for the swine flu program at the CDC. His job was to find out what possible complications could arise from taking the shot and to report his findings to those in charge. Did you know ahead of time, Dr. Hatwick, that there had been case reports of neurological disorders, neurological illness, apparently associated with the injection of influenza vaccine?
Absolutely.
You did?
Yes.
How'd you know that?
By review of the literature.
So you told your superiors, the men in charge of the swine flu immunization program, about the possibility of neurological disorders?
Absolutely.
What would you say if I told you that your superiors say that you never told them about the possibility of neurological complications?
That's nonsense. I can't believe that they would say that they did not know that there were neurological illnesses associated with influenza vaccination. That simply is not true. We did know that.
I've said that Dr. Hatwick has never told me of his feelings on this subject.
Then he's lying.
I guess you would have to make that assumption.
Then why does this report from your own agency, dated July 1976, list neurological complications as a possibility?
I think the consensus of the scientific community was that the evidence relating neurologic disorders to influenza immunization was such that they did not feel that
these sorts of reactions still happen all of the time. It's just that nowadays people are more so shamed and told they're crazy, or, you know, if they're very, very lucky, they get to be one of the few people that go through this monkey sort of court system that they have set up now to direct all of the reactions, and they didn't have that back then. But you get the idea. You get what I'm saying. I'm saying that the pharmaceutical products that they have to offer come with risk and complications. And, I mean, this is a system of the body we don't even fully understand. We don't even fully understand this, just like we don't understand how the contagious aspect fully works. And we're just trying to throw products onto the fire. Why can't we just look at what's missing? What's causing this storm, the cytokine storm? I want to look at something else, but first I want to show you that vaccines have been around. We've been doing this since the late 1700s. A lot of people think of the Spanish flu, which happened in the early 1900s, and they think, oh, well, you know, we weren't vaccinating till 1950, 1960s.
America's founding father. But did you know he's also the founding father of mass immunization in America? Now, if Washington had lost the Revolutionary War, there'd be no Washington Monument. No one to inoculate every person in the Continental Army. He had to force some of them, but inoculation helped the Patriots. Step 1. Take infectious goop from somebody with a mild case. Step 2. Squish this goop into a cut in the skin, usually on the arm. And step 3, cross your fingers and hope for the best. If you do it right, the survivor gets immunity against smallpox. But there are risks. For instance, when it was tried in Boston during the 1721 outbreak, about 2% of the inoculees died. That's a lot better than the 14% death rate amongst those who caught it naturally, but there was still a lot of opposition. In fact, 18th century anti-vaxxers firebombed the home of the man leading the immunization effort in Boston. They accused him of spreading the disease and defying the will of God, even though he was a minister himself. By the start of the Revolutionary War in 1775, doctors had gotten a lot better at inoculation, but opposition remained. Even George Washington initially thought it was a bad idea to inoculate his men.
Once again, what do we see with all of these pandemics? There seems to be war going on. very, very harsh conditions people are living in, breeding grounds for disease, just like with cholera. We didn't have vaccines for that. That went away because people stopped shitting in the street. They stopped drinking their poop water. So, yeah, infrastructure is a huge, huge part of this. Nutrient deficiency, I'll say it again. These troops, these people were probably very deficient, eaten very, very poorly. We have fear, stress. We see this with this recent pandemic. They're inciting so much fear into people. So, what else do we have? Vaccines? They were here all along. Not saying that vaccines always cause this sort of thing, but I would say they're just one more burden to the system.
Earth, and we put satellites emitting radioactive frequencies in the Van Allen belt. Within 6 months, we had a new viral pandemic. Why viral? Because the people are poisoned, they excrete toxins, they look like viruses. People think it's a flu epidemic. In the 1918 epidemic, the Boston Health Department decided to investigate the contagiousness of this. So they, believe it or not, took hundreds of people with the flu and they sucked the snot out of their nose and injected it into the healthy people who didn't have the flu, and not one time could they make the next person sick. They did this over and over again, and they were not able to demonstrate contagion. They even did it with horses who apparently got the Spanish flu, and they put bags over their head, and the horses sneezed in the bag, and they put the bag over the next horse, and not one horse got sick. You can read about this in a book called The Invisible Rainbow by Arthur Furstenberg, who chronicles all the steps in the electrification of the earth and how within 6 months there was a new flu pandemic all over the world. Kansas to South Africa in 2 weeks, so the entire world got the symptoms at the same time, in spite of the fact that the mode of transportation was horseback and boats, and there's no explanation for it. They just say, we don't know how that happened. But when you think about it, with these radio waves and other frequencies that some of you have in your pocket and on your wrist, you can send a signal to Japan and it arrives instantaneously.
So we have Dr. Cowan talking about Wi-Fi and electromagnification with all of these outbreaks. I wouldn't completely rule that out. Again, it may be just another factor. So let's go over these factors. We have infrastructure issues, vaccines, electromagnetic fields, stress, fear, and nutrient deficiency. I would say the hugest part of this is nutrient deficiency, because you can't deal with any of these things if you're deficient. To sum it all up, we know almost nothing about how contagions spread. A lot of this is based off of assumption because we think we have good data that shows that quarantining practices work, that herd immunity and maybe it does. Herd immunity may work wonders. Maybe this is all right on point and we just can't figure out how. We can't prove how this is happening. But we don't know. So we need to keep looking. And we need to keep looking at what prevents this cytokine storm, because this seems to be the cause of death. And all of these other factors just play a part.
You know, today, the 2001 anthrax attack, I have absolutely no doubt that was a U.S. researcher from USAMRIID, the U.S. Military Research Institute, that did that, okay? So we want to be careful how we share this information, and I believe it should be classified. Well, that finally came to a head last summer. I wrote about this in the book and was somewhat panned when I first came out a year ago, that the next one I really worry about is smallpox. And we have published all the sequences for how to make smallpox. Smallpox is a huge virus. It's like a 1,600-story genetic building, and we thought no one could ever do that. This past summer, a group at the University of Calgary actually made horsepox de novo, which is an identical size to smallpox, all the same issues, and they published it. And right now, there is an easy user's guide out there how to make smallpox virus. And we now people are starting to wake up. In fact, I'm testifying at a hearing in a couple of weeks in Washington on this very issue about now the time people are starting to realize. The last thing I'd point out to you, remember cell phones 15 years ago? Remember those walkie-talkies we had? Remember the limited use for those cell phones? Today, think where we're at. Well, at the same time that technology has changed with our iPhones, Galaxies, whatever, lab technology has changed dramatically. We now have high school students and college students that can actually use tools in the lab that 25 years ago were only available in the most sophisticated government labs in the world. And so we've actually made it easier and easier for them to create these quote-unquote live bombs that could be used, and even if they're not even intentionally trying to hurt people, terrorists, once they get out, unlike a bomb that goes off and that's it, these will spread and spread and spread and spread. So